We're your hosts, Susan and Stephen, mother and son, unravel the complexities of the mental health traps people fall in. Join us on this podcast journey as we demystify the mental health labyrinth, explore common issues, and provide you with tools to navigate this sometimes extremely daunting terrain. You can expect engaging conversations, personal stories, and probably also have a laugh or two. Access to mental health care should not be what causes you additional stress. We invite you to follow along, and together we can embrace the darkness together.
Hello and welcome back to our next episode for Mental Health. It's a Trap. Today we are going to be talking about the first session of what it looks like to go to therapy. So I know we talked about how to find a therapist, going to Psychology Today, checking in with your insurance, also asking the therapist if they accept your insurance, because sometimes they say they do and sometimes they're no longer on that panel, and it can really suck to get a big bill that you have to pay because they don't take your insurance. And so we wanted to briefly kind of go over what a first session could look like. And there are different aspects because sometimes it might be short-term therapy at a clinic or hospital. Sometimes it might be short-term therapy with a private practice person. It could be at a community mental health practice, or it could be something that's more long-term.
Yes, and so it can vary depending on, who you work with, what their style is, what their process is within the place that they work. I work in primary care, so we focus more on short-term therapy, and I look at it as more of episodic therapy, right? So when something happens or they're struggling with a situation or experience, they come in, it's generally 8 to 12 appointments, and if they feel like they need to continue with therapy, then I can support them in finding a therapist in the community. And sometimes during that initial appointment, we kind of assess whether they start with short-term or just go to longer-term therapy. So, I look at it as short-term is what I do, longer-term is what others do in the community, in private practice, community mental health. And so, yeah, it can vary depending on, where you go.
Yeah.
And I think the process is very different, right? I don't do a full psychiatric evaluation or, just to do an initial intake evaluation. I do a shorter term one just to kind of get an idea of what's currently going on and not necessarily focusing too much on past stuff. More focused on current stuff. So how do I work through this particular situation? Whereas when I worked in community mental health, it was, let's get an idea of, what's going on in your life. And that's like a full intake evaluation where you're doing a biopsychosocial assessment, and you're looking at medical history, any trauma history, any hospitalizations, medications, social, how someone's functioning. So again, those processes are very different. And generally, those intakes are about an hour, and sometimes in community mental health, they could be up to an hour and a half.
Yeah, that's long.
It is long. And then it's people go into this and they say, I don't know what to expect. I don't know, what they're going to ask. And, and I think that could be a question when you're calling around and you're looking for a therapist is, what is your process at your agency or at your practice or at your clinic? And asking about, I would say in general, most places will do an initial intake with any new client because they don't know you, so they have to gather some information to identify, if it's a good fit for you to be there, or maybe you might be a better fit somewhere else.
Mm-hmm.
So starting with someone and going through the whole thing, and then they say, well, I don't know that we can help you here in this practice. Let us help you find someone that can. And then the person's like, I have to do this all over again.
Yeah, that's a pain in the butt because it's like it makes me think of I've been having conversations with people around, or kind of they share like how unhelpful it is to have to retell your story over and over and over again. But that's almost like not the norm, but the expectation, or I don't know what the word would be, because you do, like, if you find a, like, if you, let's say you go through five therapists, because it's important to find the one that works for you, right? And then it's like maybe you give up after the first or second one because you're like, I don't want to tell my story over and over and over again. Or I already told it once, or I told it twice. I'm done because I don't want to have to keep telling my story. I think a part of that is not having a relationship, right? Because if you don't know someone, why are you going to tell them your, and I guess in some ways, your deepest, darkest secrets, like the really bad stuff that you've been through? Even in, like, when you talk about community mental health, when they ask all those questions, and a lot of, other places do that as well, for me, there's a disconnect because then it's like I'm sharing all of this stuff with this person that might not have anything to do in this current moment with the problem that I'm coming to you for. And although all of that stuff can inform, right, like how we connect you to the most appropriate therapist to help you with whatever you're going through, how it can also be damaging if you're, retelling that story to every therapist. And I know that with insurance and liability, you can't just be like, oh, this therapist is going to tell the next therapist, and this therapist is going to tell the next therapist. So, I mean, for me, a potential solution would be is to, like, when you're talking with therapists, you even have the opportunity to say, even if it's not a good fit, to say, hey, I don't think this is going to work out. Is there any way that you could give me like a summary or a, a, a summary of the session, or a summary of your thoughts, so that I can share that with the next person I find? I don't think people naturally or have ever really done that, but I mean, without having to tell your story over and over again, right?
So, so I think the flip side to that, and I hear what you're saying, so it can be more about I had an intake with this agency, and the wait list is too long, or they don't have a therapist that's specific to my needs. So you can always sign a release, and the next therapist that you see, they can then request the intake report and review it. So I worked, so I'm going to bring this up because I think it's a little relevant. So I worked with an individual, and this individual needed more support than I could provide. And so went to a community mental health center and had an intake done there. They did not find this individual as eligible. And, in terms of what their criteria is in the agency. And I knew from working in community mental health that this person was eligible. And so, interestingly, the individual was presenting very differently during that intake because, again, I don't know this person, I don't have a connection, was very well spoken, very intelligent individual, and so was able to kind of minimize the experiences that were occurring in their life. And I had this person sign a release. I called the center. I talked with a director, and I said I would not have sent this person if I knew they were not eligible, because I've worked in community mental health and I know what that looks like and I know what the criteria is. And so the individual signed a release for me to also submit the notes and the psychiatrist evaluation that we had done as well, and the scores on the questionnaires. And once I had the conversation, they were like, okay, this makes more sense now. So sometimes we can have to help navigate that process because I had a fairly good relationship with this person, and now I'm sending them off to another place. And it's like, I don't really want people to know how much I'm struggling because I feel vulnerable. And there was a lot of trauma and things like that. So, being able to navigate that can be overwhelming. And so I think sometimes that can be helpful to sign a release and say, can you at least request records or have a verbal conversation just to get some information, right? Because it can be really hard for people to be vulnerable and to share their story over and over. Again, hopefully you don't have to do that process 5 times in a row, that you'll be able to find someone that you can work with. And I always say there's my 3-try rule. The first time, you're both anxious. A therapist is anxious at times, meeting with a new client. It's very natural. And the second time, at least you kind of know what they look like. They know what you look like. And, so you go, okay, let's try this. And by the third time, hopefully you'll know better. Is this really going to work? And even in the process of working with people, things can come up where they may say something that kind of hits you and it kind of makes you feel a little off. I would encourage people to talk about that with a therapist and say, you mentioned this, you said this, and this is how I felt about it. And it allows for learning how to advocate for yourself and for people to be accountable for what they say and their behaviors and their choices. And not that it was probably done in any malicious way. It's just more about talking about the uncomfortableness in the room.
Yeah, I think that's one of the things that people need to know, in a sense, is like, why are you going to therapy, right? That can also be hard if someone's like, I really don't know why. I don't know what the problem is, but something's off. So there's kind of like the gray area of having an idea of even the outcome that you want. Obviously, it's usually you want to change, you want to not feel empty or not feel angry or not feel a certain way, or if you've been through like a trauma and you can't sleep or you get flashbacks, like those are like kind of tangible things that you can talk with the therapist. And a lot of them, or more times than not, they offer like a free like phone consultation. So they'll give you 15 minutes. So it's always a good idea, even in doing that legwork, is just having, 5 questions that you want to ask them. Like, so if it's, if we go like simple, like anxiety, it's like, so I saw that on your profile that you specialize in working with anxiety. How many people like have you worked with? Like, and I don't think people know that they can ask those questions. And so they just go, oh, they're the expert. They know what they're doing, versus like getting, because even on Psychology Today, people have like 50 things that they're an expert in. And it's like, are you really? Like, sure, you might have worked with people that have had all of these issues and you've helped people with a lot of things. But there are people who specialize in specific things that may or may not help. It just, again, it's not specific or a magic wand, but it's good to ask those questions and to be aware of you can interview them because you are paying for their service.
Exactly, and I think that that's what that 15-minute consult, and there are people who do offer. There's actually a lot of therapists that offer that 15-minute consult, and I think it's important to be prepared for that, right? And so I've supported people in making calls to find therapists, and they would leave a voice message and they went on, and I struggle with this and I have that, and and it's just diarrhea of the mouth, really, right? Because they're feeling anxious and they need that support to make those phone calls. And so then I go, and that allows me to see, okay, how's this person doing this, right? And so we'd get off the phone. There's nothing I can do. The voice message is there. So then I would sat down with the client and said, okay, let's write down the information. This is my big thing about fluff. I call it fluff. Okay. So my fluff is all the stuff that's not irrelevant in the moment. I mean, that's irrelevant in the moment, sorry. It does not make any sense to, have diarrhea of the mouth and leave all this information, because then it feels overwhelming to you. It may feel overwhelming to the person that's listening to it and going, oh my gosh, like there's a lot of stuff going on here. So I like the questions, like make your bullet point list. I'm looking for a therapist who works with anxiety. This is my insurance. I'm calling to see if you accept new clients. I struggle with anxiety. Here's my phone number, please call me. So that just opens the door, right? You don't want to like give all of this information, right? Because you will have to do that at the intake.
Yep.
So it's like breaking down the process of those steps. And so, keep the fluff out, give the bullet point information. The therapy is when you can add more fluff and other things unfold and unravel from there. And it helps you to kind of identify, okay, so you've got all these things, and how do we prioritize that? What goals do you want to work on? And then helping them identify objectives to reach those goals and breaking things down into smaller steps. So, yeah, I think that's really helpful, is to be prepared in making the phone calls.
And also asking, like, the simple question is like, how do you do therapy? Because everyone does something different, right? Everyone's skilled, whether they take additional training and do EMDR or ART, or if they're an art therapist, or there's even dance therapists, and music therapists. Like everyone, like I think sometimes too, we get stuck on like just talk therapy, which, is probably like, unless you're in a specialized, like again, music or art or dance therapy, you're generally going to be taught, basics of talk therapy. But then when you get out of school and you specialize in certain things, you can offer, even breath work. You can get certified in breath work and use that as a modality. You can do sand tray therapy, or if you work with children, it's, you can do play therapy. Although I know Becky talked about this last time, or maybe she didn't talk about it, but like when they're like, oh, you're just playing with my kids. It's the same way as like, oh, you're just, a therapist is like a friend that you pay. They're like your best friend. And it's like, I don't know why people's like, I know I've said it, but now it's like, why do we like, no, you pay a therapist because of their expertise, because of what they went to school for and how they can help you. If you want to go talk to a friend, like, I mean, I'll be, you want to be my friend. Like if my friends want to pay me to talk, sure. Like here's my Venmo.
Right? I know. Yeah, it's true, and I think that that's the part too. As you're looking for therapists, it can be really overwhelming when you look at the list, right? So they have it. It's basically, even if you look at psychologytoday.com, and you look at a therapist, and it gives us a brief bio, and then the insurances they take, and their license, and the types of therapy, and then areas of specialty. So the areas of specialty, there could be 20 to 30 things checked off, from anxiety to, personality disorders, to mood disorders, to relationship issues, to depression, bipolar disorder. I mean, the list goes on and on. And so people look at that and they're like, wow, this person is really knowledgeable. So we can have general knowledge of many areas, though really, where is your specialty area, right? And so that's the question to ask is, I noticed on your page that you focus on a lot of different areas, and what are your top three? And sometimes even on psychology, they'll put their top three specialties. So the anxiety, depression, and relational conflict, or mood disorders, OCD, and panic disorder, like whatever the things are. And so it's important to know that information, because if you're looking for anxiety and you have someone that is like IFS trained and it's more trauma work based, right? and you don't have a history of trauma, does it make sense? It's like if I have trauma, I'm not going to go see a marriage therapist if that's their specialty, right?
Mm-hmm.
When I was looking for a therapist when Stacy died, and I called, and the questions I asked were, have you experienced grief in your own life? I don't need the details. I'm just asking a question. It's a yes or no question. I don't need the fluff even from the therapist, right? So, and if not, have you worked with other clients who have experienced loss? So I asked those questions because and at the time I wasn't in the field, though I knew that I was in some really raw and heavy grief after losing her, that I needed to work with someone who understood grief and loss, depression and anxiety,
Mm-hmm.
because of all parts of the grief process, right? And the therapist told me that she had worked with people who have experienced loss, sudden loss, long-term illness loss, all those things. And I'm like, okay, so I'm gonna give her a try. She was my saving grace. I lucked out on my first therapist, so that was really cool. That's not always the case for everyone else. So again, it's okay to ask the questions. I mean, you can't ask personal questions like, how old are you and where do you live, and how many kids do you have, and are you married or divorced? Those are all irrelevant anyway.
although people probably will still try and ask, depending on like, uh, next.
Yeah, I mean, I had a client back in the day, a male client, who had a traumatic brain injury
Mm.
and had some fantasies about me, I guess, or whatever you want to call it, and would ask me, "Are you married? Are you?" And I'd say, "That's not an appropriate question to ask," and what relevance does that have to your therapy? And pushed it back on him, and then finally said, well, if you continue to ask these questions, it might be helpful if you work with another therapist. Oh, no, 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 I don't want to work with another therapist. Okay, so let's have some boundaries. And I mean, I was okay with it. I could manage it. It wasn't uncomfortable for me. I just don't get in those spaces. And ended up having a really good working relationship, and he made a lot of progress. And so, again, it's being able to talk about that uncomfortableness,
Mm-hmm.
even if it's inappropriate behavior, to the comfort level of the therapist. Some therapists are not comfortable with that. I tend to be comfortable with a lot of things. I'm like, bring it on, and so, again, it's having healthy boundaries, and when you're working with someone and you work with them on a weekly basis for a while, you get to have a comfort level. So you have to be careful and have boundaries around that, so that you don't cross any lines and you don't allow the client to cross any lines, and keep it a therapeutic relationship.
Mm-hmm.
Which kind of brings us into, some other parts of the therapy that we had talked about briefly, about confidentiality. That also applies for therapists keeping their information confidential from a client to the best of their ability, and vice versa, and not talking about clients' information with others, and holding that space for them and keeping it safe. And so confidentiality is a big part of our job, is to protect the client. And another piece is being a mandated reporter,
Yep.
right? So as therapists, we're mandated to report child abuse, any harm to a child, a minor child, elder abuse, or those with disabilities. And if someone reports, I'm going to go and harm this person, and they provide you the information, we have a duty to warn. We have a duty to warn that person and the police. So those are things that we're required to report. We don't have a choice. We don't get to say, oh, I won't report that because I don't really think they're going to do it. That's not, it's not for us to it's up to us to report, it's up to them to investigate, whoever we're reporting to. So if I have to make a report to DCYF for a child safety, I have to report the information, it's their job to investigate. If I have to report to protect an elder, same thing. I don't investigate, they do. The Bureau of Elder Services. And same thing with duty to warn. So those are we are mandated to report those things. And so it's good for people to know that. So, and we don't tell people that so that they are fearful of not processing things in therapy sessions. It's just more about keeping everyone safe, including the client.
And I also think it's how you say things too, right? Like, and explaining it that way is like, this is, for your protection as well, but also in terms of like, in some ways, collaboration, because sometimes the therapist will say, like, if they reported, like, oh, so and so beat this child or my spouse or whatever, right? And, it's one of those things that some therapists will, end the session, let you walk out the door, and then call like Child Protective Services or the appropriate place. And some people will say, because you told me that and you gave me like a name and it's your spouse or someone that I have to report that, right? And so like also navigating that with them, which I guess is the step after if it does come up, but not be, because I think a bigger stigma, especially when it comes to social workers as therapists, is like, even just being a social worker, it's like, oh, you're going to take my kids away from me. And so you already have that sometimes if it's specific to they mandated therapy because of abuse or neglect or whatever that might be. And they have to see a therapist. And so maybe they're not sharing as much, or there's kind of like that, well, you're just going to take my kids away anyway, so I'm not going to talk to you at all. So kind of like those little nuances. But if you're able to connect with them in a way that it's like, I'm not here to take your kids. Like, my job is to, work with you with this current issue that you're going through and to partner with you to see if we can make things better so that so we can keep the kids in the home. And I think a lot of the times, or I hope a lot of the times, that a lot of places do want that because of, in this instance of how much more or how much trauma could be potentially caused by removing the kids or those kind of outcomes.
Right. And I think so. I've had to make calls and reports in the past, and the first person to know it is the client. First and foremost. So if I need to make a bees report, and I've had to do that. I did that with a client, and the client was informed, and I went to the home with the bees reporter, with the staff member, to support my client during that process, because I knew that the client needed additional support and services, and I knew that they would be the agency that would help to, navigate that process. So it's not always, and even with DCYF, sometimes it's not always about we're taking your children away. It's like, how can the system support you in having a healthy home for you and your children, right? And so what supports and services can we put in place to do that? One of the other pieces I talked about, homicidal ideation, as a duty to warn, and then, protecting children, people with disabilities, and elders. Also for the client, if there's suicidal ideation happening and I feel like they need a higher level of care, I work with them to try and do a voluntary admission and help navigate that process. And that I've had to do in the past as well. The last thing I think most people need, particularly if there's a lot of trauma in someone's life, is to call the police and have them do a wellness check and blindside a person, which then decreases the trust in the systems. The police department, the therapist, the agency, everyone. It just really impacts that. So the more transparent and supportive that we can be in those times when we might need to make those reports, and try to keep the client a part of the process, I think sometimes the outcomes are better.
Yeah, I mean, because it's a relationship of of trust, right? First and foremost, you're not just and that's like you said, like that's what breaks trust is like someone shows up, someone calls them, and sometimes people don't know, and sometimes people do know. Like I know you called on me, and so it ruins the relationship, even if they have to be there, or they leave, and then it's a potential to cause more harm because of the work that you did with them, and then how it could keep them from wanting to engage with other therapists, and so kind of gets sticky. Let's see. Is there anything else that we might have missed? We talked about asking questions, kind of a brief introduction, confidentiality, goal setting is a big thing. It's like, what are, the person's goals? Like, what do you want to get out of therapy? Again, sometimes you don't know. So you can ask, like, how do you do therapy? Because certain therapists might have a specific structure. Let's see.
And I think in terms of that too, right? So identifying the goals. So sometimes, and I'm going to do a shout out to therapists, because sometimes we're not in the same space with the client as a therapist. We think, oh, I hear all of this information that they're sharing. Oh, we're going to work on this and we're going to work on that. No, 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 no. What does the client want to work on, right? And that's the biggest thing we learn in school. Meet the client where they're at. And because if we try to get someone where we want them to be, I don't think we're doing our job. Because it's not about what we want, it's about what their needs are and what they want. So I might say, oh, the goal is to go out and socialize. And the client might say, well, my goal is to just get out of bed every day, right? So really kind of talking about and coming up with, from the client's perspective and own words. We can support and use motivational interviewing to find out what it is that they want to work on and prioritize a list if that's helpful to some, and just working through that and finding that. And I think one of the other things we talked about is, how long is therapy? Am I in therapy for 20 years, 2 years, a year? That's all dependent on, as long as you are actively working on goals, meeting the goals and creating new goals. There's no time limit on therapy. There are some people that like the short-term, solution-focused, I just have this one issue, I want to work on this, and they do, and they're managing, and they're good. Where trauma work can take a little longer, other challenges that people may be experiencing could take longer. So I don't know that putting a time limit on how many sessions, I think that's kind of hard for therapists to answer. And I think one of the big pieces is termination, right? So therapists start therapy already thinking about the termination process. I don't really like the word termination. It's just the word that they use in the field. I'm hoping that we can come up with a different word. So it's more about, a therapist does their job when the person reaches their goals and can function in their life based on what they came in to work on, right?
Mm-hmm.
So it's really, I'm here to help you help yourself and be able to live life to whatever that looks like, because that looks different to each person. And so being able to, have that in our minds of, I'm meeting with this new person. It doesn't mean I'm kicking you out the door. And if something else comes up later down the road, come back for a tune-up. That's what I say to them. You always come back for a tune-up, right?
Mm-hmm.
Even in the short term that I do, when I start to have closing sessions with patients, and I'm like, okay, so we're kind of at that spot. We talked about it initially, that it's short-term therapy. And so I want you to start thinking about where you're at, where you started, and have you met that goal? Do you feel like you are doing better now than when you started? To start have them thinking about where they're at with and when they initially came in. And, and sometimes they come back and they're like, yeah, I think I'm good. I'm like, cool. If you need to come back, you just request another referral from your provider, and we'll get you right back in and work on whatever that is. And so I think it's like I like the episodic. So yeah,
Yeah, I think another thing to consider too, depending on who you work with, because if you're working with a private practice therapist or someone who generally has a wait list, for me, I wouldn't say there's anything wrong with a person scheduling, whether you call it a maintenance or a tune up visit, even if it's 3 months down the road or 6 months, so that you could at least have something. Because if you don't, the other thing is they could, fill up and not have space. There are therapists who might take time, and there are others who might not. And for whatever reason that may be, they have the right to, their own boundaries and their own health care, which kind of sucks because, someone's getting the short end of the stick, even if it's the client or if it's the therapist who is, overloaded with their case, like, right, all these different factors that we could add on.
right. And I think that's important to mention, right? We need to take care of ourselves in order to be effective for our patients or clients. And if people are feeling overwhelmed and overworked, it's really hard to be present with others, right? Because you don't have the energy, you could be tired. So, and therapists are the worst self care people in general, right? We always promote, take care of yourself, eat well, sleep well, do these things. And we're the worst offenders of it at times. And so again, it's understanding those pieces too, and taking care of ourselves so we can be supporting our clients to the best of our ability, and knowing when to draw a boundary and say, I just can't take any more clients because I'm not going to be effective in really helping you. So I think that's important for those looking for therapists to be understanding of as well, that when someone says I have a full caseload, they're not saying that because they don't want to work. It's that they may have a heavy caseload as it is, and there's just not enough time in the day.
Yeah, there's a lot of, again, other factors to consider. And if they're in private practice or if they're at an agency, you know, they might be getting thrown people left and right to take on, they're overloaded with their cases anyway. If they're in private practice, it's the same thing. It's just them and they're doing everything, even if it's their own billing and their own scheduling and their own, behind the scene things that they have to do, and dealing with cancellations and trying to fit people in. And so it's, yeah, it definitely gets, you know,
It gets wonky
yeah.
sometimes, right? And it's important for people to know that therapists are people too. They have lives, they have their own struggles in their lives, they're human beings like everyone else. And so how do we be understanding and compassionate towards one another to navigate that process and to get the help we need and be with the people that can provide what we need?
Well, we hope people found value in this topic. And again, if there's any interest in us expanding more, or if you need clarification, understanding something, I know we also went down a couple of rabbit holes, but this is the format that I think is best, even if it's just for right now, just to be informal, because I feel like there's a lot out there that are very professional or very tailored, or like, not to say that what we have is less, but it's like like being authentic and like just having conversations.
And it's just different. That's all.
So, if you have any comments, if you have any questions, if you would like to hear any specific topics, let us know. We do have a guest for our next episode, so definitely tune in for that. And we hope you all take care.